This is a good exchange between Mehdi Hasan and Anthony Fauci on, I guess it was on Mehdi's MSNBC show last night. Well, let's play this because I still don't know if it answers, sort of like the primary question. But go ahead. No sound. Sorry about that. Let's try that again. No sound.
Still no sound.
It says it's working on my end, but I don't know. It must be something.
Let's try. Third time's a charm. And indeed, it is not a charm. All right, we will get to that another time. Should we try a different one to see if it's a problem with that?
Brendan says he's going to rejoin.
Okay, Brendan will rejoin in a moment. Let's take some more IMs in that instance. Gigi Palin, I might have missed your comment on it, but thoughts on how Lasso managed to win in Ecuador? A sad surprise to say the least. Yeah, this guy's a banker. I don't know what happened in Ecuador, to be honest with you. I'm surprised by it. I don't know Ecuadorian politics well enough to make that kind of assessment. Maybe it's a COVID thing. I don't know.
Yeah, it's disappointing. I don't know off the top either, but we'll probably talk about it on Left Reckoning on Thursday night.
Noogs. Hey, Sam and crew, was just at the counter protest against White Lives Matter and KKK this weekend in Huntington Beach, California, rocking my best left is best gear and MR mask, which always gets compliments, whether protests or just at grocery stores. Nice. Like it.
I heard one in Fargo got swamped, or at least some of the people didn't show up because there were more counter protesters than white supremacists.
Awesome. All right, let's go to
the one in Huntington Beach. I think. There was anyway. That made a lot of news. There was an assault that I don't think we could probably show on the stream of an Asian protester.
Oh, really?
Or counter protester. I believe so.
Eesh. All right, let's play this clip of Anthony Fauci on Mehdi Hasan's show, and I still am not satisfied necessarily with this answer. Here, turn this.
Just genuinely over the last year, and I think you've recognized this in the past about the mixed messaging and some of the different advice they've gotten on this very thorny disease. I want to play a clip of you speaking to 60 Minutes just over a year ago. Have a listen.
Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks. Right now, people should not be walking. There's no reason to be walking around with a mask.
Given you acknowledged in that clip in March 2020 that Asian countries were masking up at the time, saying we shouldn't mask up as well was a mistake, wasn't it? A huge mistake at the time, not just in hindsight.
No, I keep seeing that clip getting played over and over again. So if you could give me 15 seconds, I'll go right back at you with this. Okay, at the time, three things were going on. We were told very clearly at the coronavirus task force, including by the Surgeon General, who's a good person all the way, that there was a clear shortage of masks. And if we went around recommending masks, the healthcare providers who were putting themselves in harm's way every single day would not have enough. Point number one. Point number two, there was no evidence at the time that masks outside of the setting of the hospital worked. There were no data to show that. Number three, we did not know that at least 50% of the infections were being spread asymptomatically, namely by people that had no symptoms. That's the reason why, at that time, I and others made that statement. Fast forward a month or two after, it became clear there was no shortage of masks. In fact, cloth mask works. B, we started to see rather substantial data that masks outside of the setting of the hospital work to prevent infection and to prevent you from infecting somebody else. And 3, we found out to our horror that 50% or more of the infections were transmitted by people who did not know they were infected. That's the reason why I changed. So, wait, let me just finish, because you showed the clip. First of all, if something is static and you change your mind about it, you're flip-flopping. If something changes, the data change, and you change with the data and rely on the data, you're not flip-flopping, okay?
This represents both, like, I think his explanation perfectly legitimate, right? Perfectly legitimate, but it also represents a massive failure societally wide, really actually with the West, just broadly speaking. Because the problem that you have with a pandemic is that you need to close the doors of the barn before the cows get out. And sometimes, and the problem is that we didn't have an ability in our society, and I think this is true across the West, to sort of like take this seriously enough to do stuff that maybe seem like the idea that we would do anything that would be in an abundance of caution, that would in any way implicate our way of life, which is to walk around without a mask, was considered like completely, you can't do it. And that's why we had this problem. And largely speaking, the Far East and the Pacific Rim area, that part of the world did not, is because they responded immediately.
Well, they had experience in the way that countries like the United States had not had experience. And so, you know, it's a complicated analysis looking at this. I mean, so I understand Fauci's explanation, but the reality is that, because of the shortage of masks, he was downplaying really the effectiveness of masks. I mean, he kind of says that they didn't know, but come on. I mean, he's an epidemiologist who's been dealing with these diseases for years and years. Of course, they would understand that masks would prevent the spread. They just didn't want there to be a run on them. And so he lied. I mean, that's, I think, the true
I think that's
of it.
part of it. I think they could have come out and said, use cloth masks, and been worried about, like, you know, use a t-shirt, and be worried about the idea that, that people would start using, like, you know, surgical masks and et cetera, et cetera. I don't think they realized it was aerialized. You know, I mean, part of this is just like our government did not did not have the mechanisms in place to deal with this as quickly as they did. And part of it was also that administration refused to take it seriously. And so we did not have that data about it being aerialized. I'm not saying that correctly, but, you know, as an aerosolized. I mean, I distinctly remember, you know, passing around a video. It must have been like probably March 20th. I mean, the first, like, you know, week or so, from a doctor in New York City who was being very explicit about, you don't have to worry when the delivery guy shows up. The whole idea is don't touch your mouth, don't touch your eyes. You know, it was all about touch. It wasn't until, you know, I think we had,
I mean, we were wiping down our packages. I was going, you know, I remember when we declared a national emergency, I was like running from CVS to Rite Aid throughout the city because everything was over, like, just with rubber gloves on. Right.
Right.
You know?
And we had a couple of epidemiologists on, I think Mark Alain Derry and Osterholm on, and both of them, but that wasn't until about April, said air, that it's not about touch. And so it took a while, but I think, like, there's a bigger failure that goes beyond that. It is a dispositional failure that we had, which is better to be overly cautious early on, particularly with something like this, than to have to worry about it after the fact. And on some level, as a country, we still haven't learned this.
Well, of course, yeah, and so but Fauci is, in his guidelines subsequently, was in some ways, trying to get people to be overly cautious and so then before that he was like erring on the side of not as much caution. That doesn't seem consistent to me. It seems like a calculated
you learn. I mean,
he's been doing this for decades.
He's never lived through a pandemic.
I'm sure, given his expertise, he was well aware of SARS and what that did in
epidemics
in Asia.
Yes,
understand. But to me, I'm not saying Fauci's a bad actor.
I agree.
I think that as a representative of the United States government, he lied to the public in order to prioritize healthcare workers so they could get a grasp on what was happening. It seemed obvious, based on the information that they probably had, that like masks, at least as a preventative measure, would have been a good idea.
Yes. But my point is that we have a society where taking preventative measures is, right? Look, it's a preventative measure to have 10% extra capacity in your public hospital system. It's going to waste money, but it's a preventative measure. We as a society just don't place, it's basically, on-demand supply type of situation. You don't build any stockpiles.
Yeah, and my point, though, is that Fauci...
Like masks, for instance. Like if we had a legitimate supply of masks in this country, that like it doesn't matter if there's a run on N95 masks by the public, because we've got 60 million of them, and we're going to send them all to hospitals and to first responders.
And I think, there's a reason he listed that as the first reason in that. And I think the other important thing about this whole Fauci lie thing is it is just a stab in the back myth on the right now. And they love it. They love that Fauci had that misguidance in the beginning so they can just disregard everything else. So that's the main function it serves now.
Yeah, I totally agree with the function of it and why. I don't know if I would have even, if I was Mehdi, asked that kind of question, just because of the implications of it for people who want to, be COVID deniers in other ways. But I'm just like, in terms of the more nuanced conversation that we're having, I think, that was more calculated maybe than we of course realized at the time, but then maybe Fauci is presenting